broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to our state's response to COVID-19 in childcare. This is part 5 in our webinar series. My name is Kiami Harris, and I am the Director of Learning and Events. We're just really excited to have you joining us today. Before we get started, I just wanted to go over a couple of housekeeping. If you have questions, we would invite you to ask those in the question and answer box that is below. We will try to get to as many of your questions as possible. In the event that we aren't able to, we will try to answer some and send them out in a later email. This session is being recorded and will be available on our website and also in an email to everyone who is registered, along with the slides for today. I now would like to turn it over to Michelle McCready, who is our Deputy Executive Director at Child Care Aware of America. Michelle?
Great, thank you so much, Kiami. Can you hear me?
Yes.
All right, have to check. Thank you. Hello, everybody, and thanks so much for joining this webinar series about how states are responding to the coronavirus pandemic. Since there is so much state-specific information that is rapidly changing, I encourage you to visit the state-by-state map on our website at childcareaware.org as a reminder. In each part of this webinar series, we focus on the decisions that particular states have made about important childcare issues, including emergency childcare, supporting families with critical childcare decisions, childcare subsidies, and supporting childcare providers to care for essential workers' children. Today, we'll take a look at 2 states, North Dakota and New Mexico, that have been very focused on supporting childcare during this pandemic and can serve as models for other states, communities, and localities grappling with similar issues. I'm so pleased to welcome 3 very dynamic childcare leaders and good friends of Child Care Aware of America. Good to see some familiar names from North Dakota and New Mexico who are with us today. I'm going to now turn it over to Anne in our Public Policy Department to introduce them officially and introduce the webinar. So Anne, if you are there, I'm handing it over to you.
Great, thanks, Michelle. And I also echo the welcome from my colleagues to all of you who are joining us today for our webinar. This series about states' responses to COVID-19 is, I think, of real interest to me, and I hope to all of you all, because what we hear from different states' experiences are common threads about the needs, the concerns of providers, families, and the childcare system, as well as innovative and promising practices that we can all carry back to our communities, use in our advocacy, and amplify in our conversations about childcare. While we're all grappling with the day-to-day and the now, I think we're also learning a lot through these conversations about where childcare can go in the future and how we will continue to sustain and build a childcare system that works for everyone. Today's webinar, we'll be hearing from 2 states about some of the things that they have been working on. And I'm going to take a minute now to introduce all of our speakers so that when they present, they can roll right through the valuable information that I know we're all here to learn more about. We will first be hearing from Secretary Elizabeth Gruginski from New Mexico. Elizabeth Gruginski is the Secretary of Early Childhood and Education and Care in New Mexico, and she has more than 2 decades of executive leadership experience administering public and private human service organizations at the national, state, and local levels. She previously served as the Assistant Superintendent of Early Learning for the District of Columbia, a role she held for nearly 5 years, where she administered an $160 million annual budget that funded programs to ensure equal access to quality services for the district's most vulnerable children and their families. DC was the first in the nation in 2009 to pursue universal pre-K, and today has the highest participation rate with 85% of all 4-year-olds and 75% of all 3-year-olds. Before that, she directed early childhood education for United Way Worldwide, where she helped expand the number of communities collecting and using population-based early childhood data, and she was the first executive director of the Early Childhood Data Collaborative, a national coalition to improve state policies and practices in the development and use of early childhood data systems. Secretary Gerginski earned a master's degree in social science from the University of Colorado at Denver and a bachelor's degree from the University of Maryland. I'm really looking forward to hearing more about New Mexico, and then we'll be pivoting to hear some about what's going on in North Dakota, where we'll be learning from Kay Larson, who's the team lead for Child Care Aware of North Dakota, where Lutheran Social Services of North Dakota holds the statewide contract to provide child care resource and referral services. She served as the early childhood field. She served the early childhood field in a variety of capacities since 1992, from a frontline practitioner in early child care settings to education coordinator at a child development program providing Head Start, Early Head Start, and licensed child care before coming to Child Care Aware of North Dakota in 2007. Child Care Aware of North Dakota assists families in their search for an understanding of quality child care, builds the knowledge and skills of early childhood practitioners through professional learning services and coaching, supports communities in developing innovative strategies to expand the capacity of care to meet families' needs, and they are the go-to place for individuals who want to start a child care business. Kay will be joined by Jessica Thomason, who is the Executive Policy Director for Family Stability and Community Inclusion at the North Dakota Department of Human Services. In this role, she helps guide the work of aging services, disability services, vocational rehabilitation, economic assistance, and children and family services divisions at DHS. Prior to joining DHS, Jessica served as the CEO of Lutheran Social Services of North Dakota, a nonprofit corporation that helps people and communities across the state of North Dakota address issues related to affordable housing, childcare, mental health, disaster response, aging services, and support for young families. Previously, Jessica was the Senior Deputy Director of the Fannie Mae North Dakota Community Business Center, where she partnered with lenders and community leaders from across the state to find creative solutions to local housing challenges. She also spent 8 years as the Senior Community Development Planner for the City of Fargo, where she helped lead the city's neighborhood planning, affordable housing, homelessness, and downtown development efforts. Real rock stars that are joining us today for us all to learn from. We're going to start by hearing from Secretary Gerginski. If you're there, we'd love for you to kick things off.
Great, thanks, Anne, and thank you, Michelle. And thanks, Anne, for the great introduction. I'm excited to hear from my colleagues in North Dakota as well. The N states are represented here today. And I wanted to just give people a little background on this new department that we are so excited about here in New Mexico. It was in the 2019 legislative session that our governor, Michelle Lujan Grisham, signed into law the act that created the Early Childhood Education and Care Department. And in that law, it consolidated a number of prenatal to age 5 programs that were located in the Children, Youth, and Families Department and that are located in the Department of Health. And those include everything from early intervention to a case management program led by nurses called Families First from the Department of Health, and then our child care licensing, home visiting, pre-K, and all of our quality initiatives and our child and adult care food program will all be under this new prenatal to 5 department that actually goes live July 1 of this year. So I was appointed in November by the governor and confirmed by the Senate on January 31st. And we have just been hitting the ground running. And now here we have this incredible global health pandemic that has landed, and, grateful for the really visionary and strong leadership of our governor, who cares deeply about early childhood. So immediately, and I think you can go to the next slide, we were able to really put in place actions and strategies that would ensure that we could continue to support our early education and care providers across the state, and really just recognizing the essential work of early childhood. So many states all the states had to make decisions about what to do in the early days. But I just wanted to frame for you that I'll talk a little bit about what we've done, but as we're moving towards thinking about the future and how we're recovering, we're in preparation phase now, moving into phase 1 here shortly. we're really thinking about the role of early education and care. And we're grateful that under the governor's direction, she's established a subcommittee under her Economic Recovery Council to specifically look at early childhood and childcare specifically as we move from preparation into phase 1 of reopening here, May into June. But as you all know on this call, childcare and early care and education is just such a, as we've all heard during this pandemic, we're essential, but what is it that we're essential for? And it is to provide these nurturing, caring environments of quality that are safe and healthy, where children can learn and grow and develop and families can feel supported, and it allows them to work and pursue their own education, and really also allowing those employers to support the development of a strong early childhood workforce. So these are the principles that we operate under as we think about how we move from current COVID to opening. We can move to the next slide. Great. So as part of our recovery plan, and these are general considerations, we've talked with our statewide advocates about these general considerations. We're talking with our subcommittee about these. Really, what does recovery look like when we think about possibly having to stop and start, or how do we make sure that we can be relatively smooth, knowing that we have this really critical essential function we're providing in communities across our state. Also, given the consideration of uneven availability of personal protective equipment, cleaning supplies, and other materials, how can our state help ensure that the early childhood providers have what they need to reopen and to always operate safely? And then, given New Mexico's profound diversity, how do we as a state ensure that equitable access to high quality services across race, gender, ethnicity, geography, and socioeconomic status? You probably have all seen in the news, our Navajo Nation here in New Mexico and Arizona and Utah has been particularly hard hit by the COVID-19. In addition to the Navajo Nation, we have 19 Pueblos and 2 Apache tribes here in the state. And many of our Pueblos have also been significantly impacted. And so as we think about reopening, we have to keep all these considerations in mind when we think about our strategies and our actions, both at the state level and with our community partners, both public and private. To the next slide. So some of the first things that I think all of us in the states had to do was working with the CDC guidance, but with other early childhood leaders and experts, putting together health and safety practices that would help our childcare facilities know how to keep children safe. We were a state that did not close childcare. We moved on March 11th when the governor first issued the first public health order. We told businesses, of course, if you close, we will support you, and I'll talk a little bit more about those supports, but we didn't mandate that they close. For subsequent public health orders, we did say that you really should only be open if you were serving essential personnel. But we knew that, so that fact, we were going to have childcare open, we had to release some guidance. And we did use the CDC, but we also worked closely with our Department of Health. And we did develop, clear protocols on group size, but also those health and safety screening practices. But this was a document that has, I think we've had about 4 iterations. The most recent one was last week, and we're going to be updating it again this week based on new data and new information, but also always looking at the exclusion practices when a child or a staff member was positive, or if they had contact with somebody who was. So a lot of really ins and outs, but it's been a great partnership with our Department of Health. And personal protective equipment was something, not only the guidance, but in the early days, as you all know, it was not available, and in some places it still isn't. I am proud to say that we have been able to distribute PPE to all of our child care facilities, face masks, we're working on gowns, gloves. Just today, the thermometers, no-touch thermometers are being distributed to all of the facilities. And through this process, we have developed a pretty intricate and sophisticated distribution network working with our resource and referral agency and providers across the state to make sure that information is getting out and that materials and supplies are getting out to our child care facilities that remain open. Next slide. So as most of you know, and all of us are having these conversations in our state and with national partners, is the issue of the challenges of reopening from a financial consideration standpoint. We are, as kind of our next phase, is really thinking about with a group size of 10 children, you know, at least those 3 and older, smaller group sizes for under 3. How does a model like that work, and how do we keep our facilities whole if we can? And we definitely welcome any ideas that we can hear on this call today and from the great leadership at Child Care Aware of America. The difficulty, as you all know, early childhood people trying to keep children apart from each other at 6 feet is not something that's easy to do. And then, as I mentioned before, the access to PPE and then additional staff needed to effectively and consistently implement the health and safety practices. So those, you know, making sure parents aren't coming into the facility, doing the drop off outside, making sure the temperatures are being taken, the additional cleaning that is required within our practices that people need to do. So just thinking about all these challenges and how we can support our childcare industry as we move through to reopening. Next slide. So you all are familiar with the CARES Act, and this is just to give a slide that New Mexico's allocation of the $3.5 billion through the Child Care and Development Block Grant was about $29.4 million, and we used it for those exact purposes that the CARES Act outlined. Immediately, you can go to the next slide, we'll talk about how we've used the funds. Almost immediately in the first week, we told providers, first of all, if you're open or closed, we're going to pay you for your contracts that you have. We're going to waive parent copays, and we are going to, we'll talk about that first. But first we said, well, the $250 differential, and we said we can at least do this for March and April. Because at the early stages, businesses hadn't closed yet, and we knew that our businesses and our healthcare providers were relying on childcare. So we wanted to incentivize people to stay open. We did also immediately say to healthcare professionals, we worked with our hospital association and developed a survey. Families could get on, it was on our resource and referral webpage, and they could ask for help for getting childcare, and we would pay for that. We also knew that some providers would close, and families with a contract there, we would still pay, but we would also need to pay the contract where the family moved to if they were an essential worker. And so we also are using our CARES funding to pay those double contracts. 2 weeks ago, we released our bonus wage incentive program, $700 a month for April, May, and June for early childhood professionals working in facilities that did not temporarily close. So those that stayed open, and then $700 a month for full-time and $350 for part-time workers. Last week, we announced the release, which will happen next week, of our Child Care Stabilization and Recovery Grants. And what we wanted to make sure is that all of our 998 licensed facilities across the state would receive funding. Again, we all know the funding we received we're grateful for, but it's not nearly enough to cover the costs of what happens in our childcare business every day. But we have allocated, based on their size, based on their percent of subsidy families that they serve, and based on their quality and whether they have infant toddler. So there's different allocation amounts, but they're very objective factors, and the dollars will be dispersed hopefully by the end of June, and we'll have spent all of our money. We also used it to purchase the thermometers and help support getting personal protective equipment and other health and safety materials to child care facilities across the state. The next thing. The next slide, I'm sorry, thank you. So the other thing is that we knew that the CARES funding was going to be helpful, but we also would need to use our quality dollars, our discretionary dollars of CCDF, and that's what we did. We used those dollars to waive parent co-payments. We sought a waiver and we're able to pay childcare contracts based on enrollment, and we're doing that March through June. Our governor really, I mean, she is so strong on this about childcare and making sure they had the support that they needed, that she said if we have any childcare employees who, you know, hopefully not, but do get COVID-19 and are not covered through their employer or not eligible for other public insurance programs, that we, through our department, will cover their insurance through our Medicaid, through our medical insurance pool in the state. Again, the enhanced health and safety practices, we continue to work on that, and this distribution system for personal protective equipment to providers across the state. We just recently were able to set up a system with all the local county emergency managers, and we have a contact in each of these regions. So all the childcare facilities in that area know who to call and place their order with, and then that person will place an order to the county emergency manager on a weekly or bi-weekly basis. So rather than having all these small and large operators coming to the county emergency office, there's going to be a central person who will submit for the area. So we're really excited about that. The one thing we did from day one, March 16th, we started daily briefings with all of our early childhood providers across the state. People could join by Zoom. We did that every morning from 8 to 9 for 2 weeks, and then we moved into twice a week, and then a few weeks ago we moved to once a week. So it's been a really great opportunity to, you know, in those early, I mean, it continues to change every day or every few days, but to have that constant connection and be able to give them updates, be able to hear what their fears were, what their concerns were, and then develop solutions together. It's been a very positive process. It's challenging sometimes because we can't answer all the questions, and we can hear really the struggles and the frustrations, but it's good to stay connected to the community in this way. I don't know if I have a next slide. Oh yeah, so there, I was talking about some of those things. So we have really, you know, just this day, we also email them pretty much daily, sometimes twice a day. We started doing webinars on things around social emotional and supporting families and trauma. And so we make sure that they have access to those webinars, both real time, but also they can access the recordings. We also record all of our briefings that we do with them, and people can access those as well. We definitely, the word of mouth, as we know in this field, is the most valuable. So having those people who are able to get on those calls and then connect with other people. And we've had a real great support from TV and radio and print media, getting the word out about the resources and supports. We also are using our meal sites and places where people come to get things that are, you know, we do have broadband issues in our state, and there are parts of our state that can't access some of the materials online. So we're cognizant of that and making sure we're finding different modalities of ways to communicate. And then working closely, we have a regular coordination with our Indian Affairs Department, and we, part of our new department, we have an Assistant Secretary for Native American Early Education and Care. And so we've been able to get formula to the tribes and the pueblos in the nation, infant care packages. We just did for all the tribal communities, 2 months of diapers and wipes and baby food, and for 0 to 6 months and 6 months to a year with a baby book and some onesies and a bassinet. So that was a great project we did with our Children, Youth, and Families Department, our department, and the Indian Affairs. I think that's the last. Yeah. So I'm open to questions, but I just would say overall that it has been an unbelievable experience of trying to stay very focused in real time, making adjustments based on the needs of a very diverse and geographically dispersed community, which I know North Dakota can also probably attest to, and just making sure that you're able to adapt and adjust and working with your other cabinet or other state agencies to help with that coordination and collaboration. So with that, I will turn it back to Ann or over to my colleagues in North Dakota.
Thank you, Secretary Grinsky. I really appreciate what you shared and your offer to take questions. I want to remind people that they can use the functions in the GoToWebinar to submit questions, which we will get to towards the end of the webinar. And now I will send things over to Kay and Jessica to tell us a little bit about what they've been working on in North Dakota.
Well, good afternoon, everyone. I'm Kay Larson, the team lead of Child Care Aware, and I'm going to start us off so you can move to the next slide, please. So I thought I would start with a snapshot of important dates in North Dakota's COVID-19 timeline. Schools were declared closed on March 15th, impacting childcare programs that were located in schools. And that Sunday evening, the Child Care Aware leadership team met in special session because the governor's announcement about school closures didn't say anything about childcare. So we knew we were going to have our work cut out for us and questions coming on Monday morning. We transitioned with ease to working from home the middle of that week. We have an agency who is really technologically savvy. All of our staff had portable technology. We're familiar with Office 365 and meeting via video Teams conferences just based on the nature of our work. We have 5 locations and some remote staff across the state of North Dakota as a single statewide organization, and so pretty familiar with all of that. So that was easy to do. It was 12 days later that the governor spoke about the essential nature of childcare, and that's the time that he announced ways to sustain operations for childcare by implementing modified operating procedures, which we lovingly call MOP, and the Child Care Emergency Operations Grant, or CEOG. And then we have some changes that are going to be implemented as of June 1st for that. The exciting thing to us was that Child Care Aware staff were recognized as key players in making some of the decisions about designing MOP and the CEOG grant for the providers across the state and sharing data with the state to help them make those early decisions. And Jessica, I wonder if you'd like to say anything about that from the state perspective.
Yeah, I'd be happy to. I think it was a really nice opportunity. You know, sometimes crisis is the mother of invention, isn't that what they say? And so the health consultants from the Child Care Aware team partnered seamlessly with our state Department of Health and the Department of Human Services staff to figure out what modified operating practices should look like. In relatively short order, we wanted to make sure we could announce that at the same time that we were announcing the emergency operating grants. So yeah, I think it, and we'll talk maybe throughout our conversation about how Child Care Aware has really been instrumental in trying to reach out to the provider community. Simple things like not having a great email list for every provider in the state, and just finding efficient ways for us to communicate with everyone when they themselves are busy. So it's been a pretty essential partnership, I'd say.
Wonderful. We can go to the next slide, and Jessica, I'm going to let you talk about the modified operating procedures or practices. We kind of use those terms interchangeably, and you'll see it on our slides even.
Yeah, absolutely. So just like Secretary Gorginski said, our governor and the Director of Human Services in North Dakota, Chris Jones, have from the very beginning really been clear about childcare being an essential part of our state's ability to help people stay working, to be able to help people provide the care that they needed, so essential workforce is able to continue to stay engaged, really focused in on protecting the health and safety of kids, of childcare workers and their families, thus the modified operating practices. But the other thing that I think is important, and I heard tones of this throughout the New Mexico presentation too, is wanting to make sure that the childcare sector as a whole was able to navigate this economic disruption and come through strong in the recovery as well, that it's essential not only for the sector, but for the health of the workforce overall. So those are kind of the underlying factors as they were laid out by our governor early on. And it was probably the last week of March, I guess, that we announced the Child Care Emergency Operating Grants, which has been sort of the centerpiece of how North Dakota wanted to try to support childcares. And so Kay pulled together just some of the highlights of our modified operating practices. I probably won't spend a lot of time on it. I have a feeling that every state has been wrestling with this in various ways, but tried to come up with straightforward yet appropriate modifications to how we try to do the very difficult work of maintaining social distancing with very young children. And so we did establish a maximum group size and spent a lot of time talking with our providers about how they could reconcile that with staffing ratios. And we did not waive staffing ratios. We did not that was another principle that I think I will note, because it was clear from the very beginning, we were never interested in making childcare less safe for kids and families and the staff who work there. And so whatever we did, we wanted to make sure that we were protecting the health and safety of everyone involved, as well as trying to help this sector stay open and really contributing to the state's ability to navigate the pandemic. So again, maximum group size, which was, I would say, the biggest challenge. There were two big challenges of what we asked our childcare providers to do. One was this maximum group size. And so for some, it was about staffing, but really for more, it was about what their space would actually allow. And so again, the childcare aware consultants were instrumental, right alongside our early childhood licensing specialists, to try to work one-on-one in a coaching relationship with providers to figure out what they could and couldn't do in their space to comply with CDC guidelines. In addition to that, limiting access to the facility by outside individuals, screening practices, what you do in common spaces, mealtime, playtime, all of those things, as well as enhanced disinfection, all of those things that you would expect to be put in place. So I would say on the operating practice side, that was probably the most difficult thing we asked people to do, was think about group size modification. On the right side of this slide, you'll note that on June 1st, we're actually making some updates to the modified operating practices. So we will go from a max of 10 to a max of 15. And so that will give some additional flexibility to providers. We are trying to keep this aligned with the guidance that the K-12 system in North Dakota has also offered. So they are having sort of a soft or a limited opening of K-12 facilities starting June 1st, and it's for a handful of functions that are identified in executive order, but it will accomplish a couple of things. It will give school districts an opportunity to really work out practices and procedures that if they do go back to a more normal, whatever that is, a more normal setting in the fall, that they will have had a few months to really work with their staff and their facilities on what that should look like. But it's also in a very limited capacity. Some of the programming that happens in schools, childcare is one. So all the childcare programs in North Dakota that weren't able to operate because K-12 facilities were closed can now open up to families again, which is a welcome bit of news for everyone. I think I'll have you scroll ahead to the next slide, unless there's anything you want to add, Kay, on the modified operating practices. Those are the things that jumped out to me as what we heard the most about from providers.
Yes.
Is that accurate? Okay. So do you want me just to run through the operating grant basics, and then I'll turn it back over to you?
I'll let you do that one, and then the child care assistance. So the next two slides.
All right, sounds good. So yeah, as Kay said, we got tired of typing child care emergency operating grant, so we call it the CEOG. And it's essentially intended to be a fairly low barrier to entry grant that goes to any child care provider who is either licensed by the Department of Human Services, or we have a status called self-declared in North Dakota. So you have to either be licensed by Department of Human Services or self-declared. You have to have stayed open, so you're open and serving families. It doesn't mean that you had to be at capacity. We actually made your grant payment based on your license capacity, not your attendance or enrollment, knowing that there were a lot of challenges, including the modified operating practices. But you did have to be open. You had to agree to follow the modified operating procedures. You had to prioritize access to the slots that you did have for health, safety, lifeline workers. And the most challenging part of the grant program, as it turns out, was the last item on the slide, which is we required that providers who were participating in this grant program modified their program's policies, if they had them, about the fee that they would charge to families during extended absences. So, for example, a number of providers will have a policy that says if you are absent from the facility, let's say you're on an extended vacation, you still need to pay your full fee or whatever that might be. And we knew the burden on families would grow over time as the K-12 system remained closed. And so we wanted to have a way to sort of relieve some of that financial burden on families, yet at the same time recognizing that decision creates a financial burden for programs as well. And so again, that's some of the rationale that we used in North Dakota to sort of justify the investment that the Emergency Operating Grant represents for providers. So again, the payment is, and we did like Secretary Groginski said, we did a lot of analysis to figure out what this payment should look like. But as it turns out, we were able to simplify it. So for people to understand it, it ends up being pretty simple. We basically pay a fixed rate per type of facility, and you'll see Kay excerpted the rate guide, and it's all on our website too. But basically a fee per license slot at your program, and we pay it out every 2 weeks. And it works out roughly to, it's close to 40% of the total allowed fee under the Child Care Assistance Program. It's a relatively significant investment. And the goal was to try to make sure that child care providers had the ability to cover fixed costs that they would be experiencing, even if they had far fewer children attending than usual. We know that if you're going to be a business and survive this disruption, you have to be able to cover those fixed costs. So our intention was that this grant would help them be able to do that, would help make it more manageable for them to follow the modified practices around group size, and would help make it more manageable for them to pass some of that financial relief onto families in the form of that capped absence or hold fee in the programs. So we have about 1,600 licensed and self-declared providers across the state of North Dakota. We saw in the first 2 weeks about 570 providers opt in to the program, even if you didn't opt in. So let's say you were a provider, you wanted to stay open, serving families in the state. Everyone had to follow modified operating practices. That was part of the executive order, regardless of whether you took the grant or not. So if you're open, you're going to follow the modified operating practices. But if you take the grant, then you also need to follow these other guidelines about prioritizing slots and capping the fee and those sorts of things. So in the first couple of weeks, we had about 570 providers take advantage of the program. We're just processing this next round today, actually, and we have over 720 providers now who have opted into the program. We see new programs joining each pay period as they either are able to open back up, as they have a better understanding of the program. It represents roughly 60% of the total capacity, licensed capacity in the state of North Dakota. The providers are all over, small and large geographies, and about 70 to 75% of all of the kids who have been attending during this CEOG period, this pandemic period, have been from health, safety, lifeline worker households, which is what we call essential workers. So we've asked the providers, as they've submitted their biweekly request for grant assistance, to tell us who is attending by age and then the occupation of the families that are being served. And so it's almost 75% of all the kids who have been attending care are from health, safety, lifeline worker households. If you want to advance to the next slide. We also tried to make sure that the Child Care Assistance Program aligned with the general parameters of CEOG. And so again, a number of the things that Secretary Groginski noted, we also made some changes around making sure we paid for enrolled, not attending, making sure that the two programs hopefully aligned. We weren't able to waive copays right away. It's something we definitely talked about. And again, I think as all of us see these months go on, I'm sure we'll be thinking again about how to help both providers and families make sure they can access this really critical resource. So with that, I will ask you to advance to the next slide, and I think Kay is going to pick it up from here.
I will. I thought I would spend a little time focused on the role that Child Care Aware of North Dakota has played in partnering with state offices. We've helped coordinate a special press conference follow-up session after the governor announced the MOP and CEOG, which was an opportunity for them to hear directly from our governor, the DHS executive director, and from Jessica. And I think that's probably the first time that's ever happened in our state. Oh, and I have a barking dog. And I got to learn the backside of doing a live Teams web event and was doing Skype for Business as well. I had one screen, 2 different platforms to monitor a chat box. It was an interesting evening. We posted numerous messages and made calls to providers and took advantage of an annual update process that was in play to inform providers about operating during a pandemic. And it's just been a huge silver lining and payoff for us. Our staff did tons of listening and really have rekindled and strengthened relationships with providers who no longer had Child Care Aware top of mind. You'll see we created a web page, and I did provide the link there, a signature graphic, which you'll see over on the side, which helped drive families and providers to that information on our website. We also tracked data using some modified flood tracking resources that we had in our files. And most importantly, we really did become the facilitator or helping connect the new staff at the Department of Human Services with our partners at the Department of Health. And you know, Jessica had mentioned that just a little while ago, that we have that strong relationship and connection with them already. So we've helped the Department of Health think about children in group settings. They think about young children, but they don't always think about what that means for them to be in childcare. We worked with the Food and Lodging Division to develop the bleach solutions and some concerns that we all had about the different strengths of solutions and the fact that the bleach on the shelf was different than maybe what our original guidance had been. And we just kind of act as a watchdog to make sure that what the 2 departments are posting are congruent so as not to send mixed messages to the providers. So our team's also been super busy just kind of coaching and providing technical assistance to providers on the numerous questions that they're asking about if they should be open, if how to apply for particular grants or financial supports, cleaning guidelines, and the list just goes on and on. So next slide. Have you ever wished that you had more information or data? We sure have had times like that in the past, and we knew that this was going to be important. And so kind of utilizing some of those flood trackers that we had, we were able to convert into, let's see who's closed, and trying to keep that up to date. And so the spreadsheet started out really simple, and we're like, well, it's not enough just to know who's closed. We want to know what's their license capacity. And in North Dakota, there's also most programs will tell us they don't care to care for as many children as are their license capacity, just based on their own comfortability with that and or how they perceive their space. And so those 2 numbers of license and desire don't always match. And more recently, we've added the permanent closures and the permanent loss of capacity. And we've really counted on our early childhood licensing specialists to really communicate with us and send those closures or updates that they have on programs that are open. So we don't have them all, but we have probably the most of a list. Child Care Aware also lifts up the data from local child care associations. You'll see in the blue box, they've been asking some really good questions. And so this comes from our FM area preschool advocates, and they just did a center survey asking how many children were attending versus enrolled during a period of time. And this survey was done early in May. And so we've just been able to lift those good things up to the state, and the answers have been just really insightful. Jessica, would you like to say anything about how the state's been using our data?
I think it's something that we all have been craving more and more of as we try to figure out both what's happening in families' lives with all of the disruptions that have been, very difficult to predict, as well as what's happening in our business community and the childcare sector being one. So I think it was late one evening, early on, I had emailed Kay and said, hey, any chance you guys could help us try to track which programs are actually open and closed, because we don't have a built-in way to do that. And it's on our list of things that are supposed to be happening this fall to be updating our early childhood licensing system within the state. But we kind of went to the standby of reaching out to the people and Child Care Aware stepped in and said, yeah, we can help facilitate that. So it was, again, it was a nice example of a simple partnership, but very timely. And so we would get these updated numbers almost daily from that point on, which gave us a sense of, are we seeing additional programs close? Or, you know, is the addition of the emergency operating grant and some of the other things we've talked about making a difference? And we were trying to have as much, you know, our finger on the pulse of what was going on as much as we could. And so this has been a helpful bit of data for us as we've been thinking about that.
Mm-hmm. Certainly has made me more curious as well as we've gone through it. You'll see we've got a reason supplied, and this past week we reached out to all of the unknowns, and we want to move all of those unknowns into one of the other reasons. And so we've made the contacts, and now we just need to update our data. So it's been fun to work with pivot tables. I can't believe I'm saying it, but it's been good. So next slide, please. I thought I'd share a little bit about our social media, and our following has certainly grown during COVID-19, and our posts are getting some great engagement. And this is just an example of some of the posts that we've made to support the childcare operations. We've helped with assistance in determining which funding supports might be the most helpful, what to do if they can't find supplies, how to update their vacancies so that they could take part in the CIOG grant opportunity, and the newest bleach solutions, just to name a few. On the next slide, I'm also really proud of our social media team for including trauma response and strategies to promote resiliency and mental health. As I was going through to capture some things for this slide, I was like, oh my gosh, I can't believe we did all of those things, and I was just so excited to see that. We've even highlighted some childcare programs you'll see up in the box that's in the upper right-hand corner. It's one of the ways that a program was connecting with some of the children that weren't able to participate in their program by sending home some opportunities for them to do some parent-child activities and be entered into a drawing for a summer fun basket. And so just sharing ways that providers are coping with the now normal to make it real, and for other providers to see that they too can do it. On the next slide, something that we're really excited about is an opportunity to send a packet to every licensed program as a token of appreciation. This is a social story on seeing other people wear masks. And we took this to a local printer, and they're printed on like a 5x8 sheet, and they're going to be on a ring binder. And he suggested that we use synthetic paper. His mom actually does childcare, and so he's like, I know all about that. You need to be able to wipe these down. And the synthetic paper doesn't tear. It's lighter than lamination and actually can be wiped down with a disinfectant or a sanitizing solution and wiped off. We're also going to be including some social emotional storybooks that we've purchased from Kaplan, and it's going to be a great opportunity for us to introduce our newest inclusion specialists and remind programs that we're still here for them. On the next slide, I thought I would just share a little bit about our QRIS, because Child Care Aware of North Dakota provides the coaching for that. Our ratings are on hold from the previous cohorts, but the April cohort is in full swing with virtual coaching visits going on right now. And we're just really proud of the providers for saying, yes, I want that support of somebody that can be by my side and be there to support me in this time. And maybe it's not all of the same QRIS coaching and goals that they're setting, but they have another person to support them through the process. And they're all aware that they can take advantage of a extension if they need to do that. We're also really lucky in North Dakota that all the required training for Bright and Early is online. We've actually, Child Care Aware hosts a number of online trainings, and we have seen just an uptick in registration during this time of people completing their training, and it just was so nice. It was already in place. We didn't have to find a way to deliver in that method. Thinking about QRIS made me think about sort of that going forward. And so one of the things that we're doing with our Bright and Early partners is just beginning to draft sort of what is that on-site visit protocol going to look like. We budgeted for some Nest cams and some lanyard microphones in the event that we have to set up a observation and be able to step out of a classroom or go out to our car and do some observation in a classroom. We are also working on a reopening checklist for those childcare programs that have closed during this time. And as COVID positive cases are starting to appear in our childcare programs, really working with providers to find ways to limit those floating staff that might cover the lunch breaks and or prep times of providers, as well as encouraging them to have parents drop children off outside, which is a blessing in North Dakota that the weather's changing and it makes it a lot easier. I'm nervous for fall when the snow starts to fly again, but I know we're all thinking about things as we go forward, and those just kind of came top to mind to me. And I'm going to turn it over to Jessica to kind of wrap up our last slide on benefits and outcomes of the work that we've been doing.
Sure. So if you want to advance the slide, and we'll wrap up and say thank you for including us in this call. It was really fun to hear what's been happening in New Mexico. We think that we hope there will be some real benefits that come from, I guess, this opportunity to elevate the profile of childcare as an essential component of a healthy workforce, and it affects every single community in our state, every sector. And it's really critical work, and it's not that wasn't known before. It was, and it was understood, but it became crystal clear for everyone that if you don't have childcare available, people aren't able to continue working, whether that's in a health, safety, lifeline profession or any profession. All of them are important to healthy communities where there's well-being for everyone. So we think that will be an important carryover from this, is just sort of the high profile nature of this as an essential bit of community infrastructure. And then also, I think there may be some side benefit of perhaps even an opportunity for growth for our childcare providers in their skills running their own business. So we tried to keep the operating grant simple, but I would say for some it has been a challenge to successfully participate and successfully apply and get the form in on time, all of those things. And so, I think again, as we develop these opportunities to work together, I hope there will be side benefits for the individuals who have been participating in maybe a more engaged way. Maybe they feel more engaged, they feel heard and valued. And so we hope again, some of that positive benefit will carry forward into the future. And with that, I know we are at our time, and so I think we'll pause and turn it back over to you to moderate the discussion, Anne. Thank you.
Awesome. Thank you so much, Jessica and Kay. And I have really enjoyed hearing about both of these states' experiences today. I thought there were some really interesting themes about how essential childcare is, about how there's a real commitment to making sure that childcare remains safe, that we don't need to compromise on that in order to grapple with an emergency like what we are in the midst of. It was interesting to hear about prioritizing the health and safety of educators as well as of kids, and to hear some practices that were similar or unique, thinking about stabilization grants and other ways to support or operating grants to help providers, and then also the role of data and technology. So a lot of really exciting ideas. We're interested in addressing a few questions if they've come in. Kiami, do you have any that you want to lift up for our speakers?
Sure do, and so I'm going to get started with one in particular. Just see, there's one for you, Jessica, that goes to, you mentioned that you report daily on open and close. What about vacancies? Can you collect data on how many openings by age of child are available in these settings? That would be key to knowing what the supply looks like.
Yes, so I was having a little trouble hearing, but I think you were asking, can we also collect data on the openings in programs? And so that's probably a joint answer between Kay and I. So we did two things. One, every 2 weeks when the programs, and we only, so I would say we know more for the programs that are participating in the grant, because every 2 weeks they actually report to us who's attending, how many kids by age. And so we have a very good sense of what sort of open capacity is versus attendance. And then on a broader scale, Child Care Aware maintains the resource and referral database. And so we made a push early on to providers to go in and update their information in the database. So any family that's looking for care, even if their own provider, their normal provider is closed, that they can find care being provided in their community. And so I think, Kay, I don't know if you want to speak at all to how that database updating has been going. I think that was one of actually the first things we said when we did that call with the governor when this was announced. Please keep your numbers updated, because we knew people would be looking.
Right, and so part of, being part of the annual update, we knew certain people had just recently completed an update with us, and so their information was pretty current. And then I would say we had a high volume of providers who called that first week to update their vacancies. We also participated with Child Care Aware of America in a mapping projects, and I think we just approved that and are sending the second round of data to them. That's actually a map in North Dakota, and Jessica, I haven't shared that with you yet, but there are dots on the map that indicate which programs are open and which ones are closed, and you can click on the different license types in North Dakota. We don't license by age, so the information that you're getting from the CEOG surveys is really instructive. Since our licensing isn't by the age of the child, that makes it a little challenging for us to report how many infant vacancies we have, but you have a good handle on that from the programs that are participating in the grant. We'll be able to click on that map and see a lot. And I don't know if every state is doing that, but North Dakota is participating in that, and it's been really fun to see that come together.
Great, thanks. Yami, were there any other questions that came in?
Yeah, so we do have a question about the age if you go up to 13 in New Mexico. So that was for Secretary Gorginski.
Yes, thank you for that question. We do. Our facilities that are receiving the supports are all the way from, most of them, 6 weeks up to 13 years of age.
Awesome. And I'm just scanning. We have a lot of comments, a lot of questions, some that we've been able to answer. So give me a second, Anne, if you want to jump in and ask something while I'm looking.
I do have a quick question for all of our participants. I feel like, and I don't want to take too broad of a brush here, but there's a little bit of a cusp we're on where some things will wrap up in June, either early June or mid-June, in terms of some of the emergency response approaches, supplemental grants or changes in funding. And I'm wondering if either New Mexico or North Dakota have thought about whether things will go back to, quote, normal when it comes to things like payments and reimbursement rates and family eligibility and things like that, or whether there's going to be more of a longer term bridge, and if that's an ongoing conversation or something that's already been decided. I don't know, Secretary Gorginski, if you want to go first, just where are your heads on that, and what are some opportunities for people in the field to contribute to those conversations?
Yeah, we're in the next phase, I think, and Jessica can maybe sympathize or empathize where there's a lot of unknowns still in terms of when things will ease, when group sizes, I mean, we adhere to the same thing. We're not going to allow more children or this, but we're pretty, we're taking it slow here in New Mexico. So we're not expecting, schools having any students until August at the earliest, even those things haven't been firmly decided. So summer programming is very slightly allowed outside of our childcare settings, and that's all being looked at. So I would say our biggest thing right now is how to help facilities that we had about 400 that temporarily closed out of our 998 facilities. And again, that we said, please close if you're not serving essential. A lot of them are at 30% capacity as far as who's attending, some as low as 15%. And so we're trying to think, as we're going to have a special session sometime in June here in New Mexico as budget starts July 1. We have to have a different model to fund, because if it's by child and they were already living on these very slim margins, if we said you can only have half of what your license capacity is, what's that going to do? And then we also have families who have contracts that they may not be able to still have because they can't have that many children in the setting, in the facility. So these are the Rubik's Cube problems that we are facing, and there's no clear answer. So I think it is being in community with our providers, working closely with our economic development department. And I wanted to echo what Jessica was saying, is really helping them connect with, as a small business, to a lot of these other resources and supports that are available to them. But we see this as probably a very, very long process without a lot of clear answers. So love for childcare, aware of America, to help think with us, because every state is doing this work, trying to figure out the financing model, making sure they have access to all the cleaning and sanitation and PPE, and then that we're training on the use and the health and safety practices, because it's not enough just to put it out there and say, hey, these are the new practices, but what are we doing to make sure that we're deeply embedding that in our professional development, and because we think this is going to go on for a while. So I don't know if that answered your question, but those are the things that we're thinking about here in New Mexico.
I appreciate that, and I think that it was a really helpful way of laying out some of the challenges. Jessica and Kay, I don't know if there are any things that you want to add, either bridges you've already crossed or things that are on your mind too that you think will be coming up in the coming weeks and months as maybe some providers who weren't serving as many kids are able to and confront some of these challenges with lower capacity and things like that, or sorry, lower attendance and things like that.
Yeah, we would echo the Secretary's sentiments and say that states are also entering a challenging budget time, just as families are in a challenging budget time, just as providers are. And so I think your Rubik's Cube analogy is a good one. You're trying to get all the sides to be, equally solved, and that will be the challenge in front of all of us, while not compromising health and safety. So I think, our approach is that we recognize the importance of maintaining strength in this sector. We recognize families are going to struggle, and we know that childcare workers themselves are families. And so just trying to figure out what we can sustain as a state, what resources we can put to the task. And again, I think learning from the experience of the last several weeks into the next several, to figure out what's been most effective, what would be most helpful going forward, and continuing to build on some of those partnerships, especially with the health consultants and the coaching. And I think that whole model of what does sector support look like? It's not just regulation, it's not just licensing, it is sector support for the well-being of children and families. So I hope that holds on. I hope that is a whole.
Can I add one thing, Ann? That was excellent, Jessica. Thank you for that perspective. And it's something you may be thinking about, but as schools are talking about these different ways to reopen with staggered schedules, or some days off, some days on, I think that's another really critical place for our schools and our child care to build even stronger relationships. In some places, they're already strong. In other places, they're completely disconnected from each other. Yeah. But when we think of families at the center of that, I think we're going to need to be in a lot of more communication, and we are here at the state level, but that's really happening at the local level with school districts. So just another thing to think about.
It's a great point. And I think there'll be a lot of gaps, for lack of a better word, to plug there, where the systems will need to be collaborators, and resources may need to be available to make that work for providers, different hours, different timing, different supplies, different experiences, and challenges we'll be all confronting. Since we are over our time, I wanted to go ahead and wrap things up first by saying a huge word of thank you to our speakers today. I learned a lot. I hope that everyone who joined us today learned a lot about state responses to coronavirus and some of the really exciting solutions that states are putting in place to help providers, to help families, and to support the system, the child care system overall. A lot of innovation and excitement, even as we're grappling with really tough times and a lot of challenges in our communities across the country. I hope that you will carry these innovative practices to your states and your communities, and don't hesitate to let us know if there is support we can provide. You may know that Child Care Aware of America recently launched our new emergency child care and technical assistance center to support the entire childcare community. So that's childcare resource and referral agencies, other system level leaders, providers, families, and employers during their COVID-19 response. And so those resources that we've made available and the ability to request TA is on our website. Up at the top of the site, you'll see a button for the TA Center. We hope you'll check out that information and utilize that resource moving forward. We'll also be continuing this series of webinars next week, so you can register for part 6 by going to our website, and also encourage you to monitor our webinar section, because a lot of great resources are flowing out there, and other partnerships and collaborations with information that we hope will be useful on the ground as people navigate all of the challenges our communities are facing. So that wraps things up for today. If you have additional questions, feel free to send us an email, and thank you for joining us.